So bowel incontinence is reality what we call fecal incontinence. And there's three main types. There is what we call urge fecal incontinence, where feces comes out when you are trying to keep it in on the way to the toilet. There is passive fecal incontinence, where feces comes out without you having any realization. And the third type is soiling, where after you've cleaned yourself, you may notice smearing on your underwear. So what causes bowel incontinence? This is a very difficult question. And people have tried to simplify this, but there is no simple answer. The commonest cause is diarrhea. Even the strongest of pelvic floors can be overcome if you have intractable long-term diarrhea. Everyone then thinks that actually a weak pelvic floor is a cause of incontinence. But research is now suggesting it's the sensitivity of the bowel above the anus, known as the rectum, and it's the sensitivity and the function of that which is the key determinant of incontinence. So that combined with a pelvic floor problem can lead to incontinence. And there's different forms of pelvic floor problems. And again, everyone talks about a weak pelvic floor, but it's more than weakness. You can actually have a very strong, non-relaxing pelvic floor, which is just as problematic. The key thing is that you have a coordinate pelvic floor, whether it's strong or weak. But any incoordination combined with being too strong or too weak with a rectal sensory issue can lead to incontinence. So what can be done for fecal incontinence? Thankfully, a lot. And most of the people are vastly improved with simple remedies. It generally involves multiple small things to be done by the patient because multiple small things have gone wrong. The key thing is if someone has diarrhea is improve the diarrhea. And that depends on why someone has diarrhea. So it needs a whole range of investigations. You can see a pelvic floor physiotherapist. And this is a physiotherapist who's a specialist in this type of problem. And they can help with you with your diet, pelvic floor function and coordination. Then there are other things such as colonic irrigation, anal plugs, and learning different types of control measures. There are surgical interventions, including anal bulking, and there are other nerve type stimulation procedures such as tibial nerve stimulation and sacral nerve stimulation. These are also very successful. Then there are the classical surgical interventions such as rebuilding the anal sphincter. And then for those who fail all measures, we would consider some kind of colostomy or ileostomy. That's where the intestines are brought up to the abdominal wall to reduce the amount of feces coming to your bottom. Now, none of these things will be forced on an individual. It's complete teamwork and the patient's in charge of what they want for themselves. And nearly everyone we can make better, but of course you can't make everyone perfect. What food should you avoid with fecal incontinence? Now, this is a very difficult question. If someone has IBS and it's a diarrhea predominant IBS, then really the foods you should avoid are the ones which cause the diarrhea. And simply by thickening your stools, your incontinence will improve. But what foods they may be are an individual dependent thing. Seeing a specialist dietitian may help, but generally those people with IBS diarrhea may need something called low FODMAP diets and avoid FODMAP foods. Some people have a dairy issue or a gluten or a wheat-based issue, but everyone can work that out for themselves. So in summary, it's really avoiding foods which loosen the stools. There are various aspects of this question. If your actual bowel frequency and consistency has changed, and that's led to incontinence, yes, then you should treat that like anybody whose bowels have changed, to exclude a large bowel cancer, a colon or rectal cancer. If your bowels haven't changed and you have incontinence, then it's specifically no. But you should always go and see a doctor if you start having incontinence. There are a few people who develop anal cancers. This isn't a bowel cancer. This is a skin cancer of the anus who can develop fecal incontinence. But this is rare, but should not be dismissed. So what type of doctor should you see for fecal incontinence? I think initially see your general practitioner, and they will make an assessment of your bottom. If you have diarrhea, start to help that. And they are excellent and they can help a significant number of people. If that cannot, if the simple measures don't help, then you would ask your GP to refer you to a colorectal surgeon who specializes in pelvic floor medicine. That's the type of doctor you need to see. They are dedicated their lives to people with this problem.